Welcome back. We all know someone who suffers from snoring or sinus issues.
But technology is making it easier to diagnose and treat these problems. I recently had a tour of the Sinus and Snoring MD offices in Oak Creek. Take a look.
I'm so excited to be here, Dr. Hilel. So let's talk about this, because this time of year, I feel like a lot of people are having sinus issues. What do most people come to you for? Is it allergies or sinuses or ear problems?
A combination, you know, especially now with COVID, everybody wearing a mask. People that had sinus issues before, now they really feel it because they have much more restriction in their nose. So we see people that have difficulty breathing through the nose, people that have nasal allergies, sinus pressure, ear problems, and throat problems, and snoring. That's another one that we see a lot of patients with snoring.
So what do you do for someone who comes in with a stuffy nose or feeling blocked all the time?
What we do is we talk to them, we find out exactly when the symptoms take place. Maybe it could be seasonal allergies. We take a look in the nose. We have a little spaghetti camera and actually make a video to be able to show you what we see. We're also able to perform an allergy test.
So once you find that there's a blockage, what do you do to be able to treat some of the issues that you're seeing most commonly?
We do in-office balloon sinus dilation. We're able to do minor corrections of the septum. We're able to correct the nasal valve when it closes up with an implant or with energy. We're able to shave polyps with a vacuum or with a shaver. It's like getting a haircut. There's really no blood vessels or nerve endings, so we can do that. We have all the procedures available for the nose.
And it's nice because it's all right here, and you can offer either very light or actual sedation, right?
That's right. We have all the options. Sometimes we just use a gel, an anesthetic gel or an anesthetic spray. We have laughing gas, nitrous oxide, which is amazing. The patient can drive themselves to the procedure, and after the procedure is done, they can go back to work. It doesn't
it wears off, right?
It wears off completely, and we're using it quite a bit, the laughing gas. Some patients can get oral sedation. We can prescribe them some oral sedatives. We also have the ability of doing IV sedation, and if need be, we can also do general anesthesia. So we have all the options.
Dr. Plein, thanks for joining us.
Yeah, thanks for being here.
The CT scan. And this is something that you guys use to diagnose in office, right?
Yes, absolutely. It's a really great tool that helps us actually look at people's sinuses. So we can actually see the openings to the sinuses. We can see if there's inflammation or blockage in the sinuses or active infection. It's a really quick test. It takes about a minute. It's very, very little radiation. It's kind of like a dental x-ray. So the nice thing is that the camera lets us look inside the nose, but we can't actually see inside the sinuses. So it's kind of like the camera lets us look down the hallway, and the CT scan lets us look at the rooms off the hallway to see if there's a problem. Are the doors not open wide enough, or are there blockages further that we can't see? So really the two things work together to help us really fully diagnose the whole problem.
So we're able to generate a three-dimensional GPS map. It's actually an electromagnetic field map. This patient has a lot of sinus disease in between the eyes, below the eyes, and above the eyes. He also has a deviated septum. You can see how this wall is crooked, so this patient doesn't breathe very well. It's pretty impressive in here. In the past, to be able to open up the sinuses, we would go with drills. So it was a very aggressive procedure. Nowadays, with navigation and with balloons, we're able to find the natural opening of that hallway, like we were talking, into the room and expand them and then flush them out.
You also use stuff like this for snoring and sleep,
Yeah, so this
right?
is a home sleep test. So one of the things that people didn't used to like about tests for snoring or sleep apnea is that they used to have to go to a facility and spend the night there, and it's a big disruption to your schedule.
Who sleeps well that way?
Exactly.
That's right.
So this you can do at home in your own bed, which is really nice. You go to sleep like you normally would, and it actually gives us data as to how you're breathing while you sleep to know if you have sleep apnea that we need to treat.
You talked about the balloon sinuplasty. What else would you do to help treat someone who's snoring or has sinus issues?
Yeah, so it depends. So everything from improving their nasal obstruction, and there are both minimally invasive procedures for that, to help stiffen the palate, either with an injection, or sometimes we'll cut off that little part, that little hangy thing in the back of your throat. It's called your uvula. A lot of times that.
What we just all call it the hangy thing.
The hangy thing. You know, or we have have implants to put in that area that can help. There's also oral appliances that can help with snoring and sleep apnea, and then of course CPAP machines also. We custom tailor it to each patient because each patient is different and each patient has a different reason for their problem.
What is recovery time like when you do these sorts of procedures?
Most of the procedures, you can go to work the next day. We don't put any activity restrictions on you. You can go about your normal life. We give you pain medication to use if you need it, but most people don't have to use it. So it's definitely much quicker, much faster than your traditional operating room procedures.
So I have your cell phone.
Yes.
Thank you so much. I think it's really great. You give everyone your cell phone number
Everybody gets our cell number.
so that they can just, because you FaceTime too.
We FaceTime, yeah. And now with telemedicine, we can see each other on the phone if need be. So all my patients get my cell number, Colleen's
All right.
number.
Well, I'll FaceTime you guys every 10 minutes from here.
Yes.
You okay? Thank you so much
Thank you
today.
for coming.
Thank you.
Thank
Thanks,
you.
you guys.
Thank you.
Thank you.
And for a limited time, Dr. Swerdlin and Sinus and Snoring MD are offering free nasal sinus and snoring screenings. Free. To schedule yours, call 262-425-5832 or just visit sinusandsnoringmd.com for more information. Got to tell you, Molly, you don't feel any of those tests. They don't
Really?
touch anything in your nose or your throat, so you don't feel it.
Because I wondered about that.
Yeah, you don't feel it at all. It's not going up and down or all the way up your
Oh.
nose. You don't even feel it. They don't touch anything.
Oh, that's awesome. That's good to know.